Hi, everyone. This is Dr. Susan Marra with Dr. Marra's Medical Minutes. And today we're going to talk about um, what's the best medication to give if you've just had a tick bite. It's a really highly controversial subject, and I'm not sure there is a one right answer. Um, I think it depends on where you get bit by a tick. Is it in New Jersey, New York, Vermont? Is it in California or or Seattle? And then you can choose which antibiotics based on what organisms are in that place. Now that becomes much more difficult now because 25, 27 years ago when I started, we could tell where someone was from based on the organisms that they had. For example, Rocky Mountain spotted fever was in the Colorado area. Babesia microtii was on the East Coast. Babesia duncani was on the West Coast. Babesia divergens was in Europe. It's not that easy anymore. And that's largely because the migratory birds have moved these ticks and things all over the place. And so now it's very difficult to know what antibiotic to put people on because, we don't know where that tick has been or it's just much, much more difficult than it was when I first started. So, in general, the standard is to provide doxycycline 100 milligrams twice a day for 14 days. And that is a good drug to treat Lyme, Ehrlichia, Anaplasma, and a tiny bit of Bartonella, and the rickettsias. So Rickettsia typhi, Rickettsia, which is Rocky Mountain spotted fever. Doxycycline is the drug of choice. However, if you have Babesia, doxycycline really doesn't help. And unfortunately, you can't just give someone Mepron or Malarone or Alinea or Coartem or Tefenaquin or um, Albenza. You just can't just give people that medicine without having documentation that they do in fact have babesia. So it's really a problem, and in particular, like where Dr. Horowitz practices in Hyde Park, New York, it has the highest density of babesia on the East Coast, with the exception of Martha's Vineyard and Nantucket. They also have a very high incidence of babesia. And so, what do you do when you get bit by a tick and you're living in those areas? So, what I would do, as I don't practice there, but I did practice there. When I was there, when people got a fresh tick bite, I put them on both doxycycline and Zithromax because Zithromax covers Bart, it also covers Lyme, and Doxy covers everything else with the exception of Babesia. And then when I tell people, let's use an herb like Artemisia, Wormwood, Walnut, something like that. And that can be the herbal sort of hit to Babesia. And so for a new tick bite, what I would do is I would put the person on, obviously, depending on the age, the dosing matters. Doxy for children comes in liquid form, and so does Zithromax. Um, Doxy for adults comes in capsules. Zithromax comes in tablets, and they're also, somewhat dosed by weight. I would put them on those medications for at least 6 weeks, at least. And I prefer to put them on 8 weeks, and then I would do the Igenex test. And based on, if they have symptoms based on what else is going on, I would test them for all of the co-infections, especially if they live on the East Coast. I mean, the East Coast is just rampant with Lyme disease and all the co-infections, and it's a problem. It's a huge problem. And, you know, to not do anything is reckless. Really, it's reckless. You know, there are certain people that want to just do herbs. That's fine. You can do Japanese knotweed, teasel, oregano, thyme, wormwood, walnut, and you know, have some success there as well. But Doxy alone, I mean, there's controversy and there's people that don't agree with me, and that's okay. I tend to be somewhat conservative because I don't want you to get sick. Because when you have tick-borne illness, it's just ugly. It's an ugly disease. It's you know, you're misunderstood. You have to schlep around to all these doctors and all this and that. So I try really hard to take a more preventive approach. So I would use Doxy, Zithromax, and then one of the herbs that treats Babesia like Artemisia, walnut, wormwood, and cryptolepis, which is a combination of herbs, and and that's what I would do. That way, everything's covered. So I hope you found this video useful, and I hope you have a wonderful day. Take care.